Well, it's 2 minutes into the hour. Welcome, everyone. Good morning, good afternoon, or good evening from wherever you're coming in from. Welcome. All right, we will get started. Um, Greetings, everyone. A warm welcome to you all for joining us for this for this important webinar today. And thank you for being here for the ISQua Fellowship Experience panel. We are truly excited to host this conversation today because for me it's one of the more important conversations. Like, where does it all end? What do you do with the capacity building that we all aim to do? And this session is designed to share real reflections, lived experiences, and meaningful insight from our panelists. They've gone through the fellowship, they are doing some work in the space, and whether you're familiar with ISQua Fellowship or you're exploring it for the first time, we hope that today's session will bring some clarity to you, some inspiration, as well as a practical guidance. I am I am an ISQua Fellow, and I'm still inspired to today from some of the things that I've learned. And thank you again for being here. We look forward to an engaging and valuable session for you. Just to give you a little correction. Please mute, and just to give you a little bit of how this is going to work, a little introduction. We will introduce our panelists and we'll go through rounds of questions with them. And this is your story, so we encourage our panelists to just, give us the raw, give us the truth, the authentic version of the reality in the space. And at the end, we'll have questions for our audience, a Q&A session for our audience. So you could certainly type it in, and at some point, we could certainly, if you want to talk, we welcome that too. Um, and I'll hand this over to Jackie to for the next part to introduce our panelists. And Jackie is one of our co-steering committee from AfCoP. And again, my name is Chika Odiemene. I did not introduce myself. I am the chair for the AfCoP community. And on behalf of the steering committee, we welcome you all. And Jackie is one of our member from the AfCoP's steering committee. Come
Thank you, Chika. Thanks for the introduction. And welcome to everybody. As Chika said, we're in for a really fantastic afternoon or evening, depending where you are. I'm just going to briefly introduce the speakers because I want to spend more time listening to them than talking about them. We've got 5 panelists today. We've got Mr. Ernest Jabi, who is the National Quality of Care Advisor at the Ministry of Health in Sierra Leone. We have Dr. Pius Kagoma, who's the Coordinator for Quality of Clinical Services at the President's Office Regional Administration and Local Government. It's a very long title. He's a medical doctor from Tanzania. And then we have Dr. Victoria Kenyeri Naruti, who's the Quality Advisor at the Aga Khan Hospital in Kenya. And we have Dr. Ahmed Nuera, who's a public health and occupational health physician. And I think, Dr. Nuera, I think I'm right, you're from Egypt.
Yes, I'm from Egypt, yes.
That's correct, yes. So we're covering all parts of the continent today. Yeah. And our final speaker is Dr. Stephen Tayobalogun, who is the Branch Chief of Monitoring and Evaluation, Data Analytics and Science at the US CDC, Disease Control and Prevention, US CDC in Nigeria. So we're pretty well covering the continent. So welcome to you all, and thank you very much for being here. And what I'm going to do now is we're going to start with some questions because, as I say, we really want to hear you more than hearing other people. So the first question, and let me, I'm going to actually pose this to all of you. If you can just give me a brief answer. The first question, because I'm sure those listening want to know, why did you apply for the ISQua Fellowship? Who's going to go first? Stephen, would you like to take that one first? Stephen, are you muted? Okay, let me go to Dr. Ahmed Nawera. Why did you decide to apply for the ISQua Fellowship?
Hello, everybody. Thank you for all this interesting meeting, really. And one of the thing I applied, the first time I got contact with ISQua was in 2018 in Malaysia in the conference there. And really, I at that time I was doing my master in public health. I was a clinician and still a clinician too. I got amazed about the ISQua and the fellowship and what they are giving, this international perspective we are getting from ISQua. And it was advice from one of my friends. Then I entered the website of the ISQua Fellowship, and I really I found a lot of resources which I need to get this international perspective and adding to myself this quality and patient safety and learning the quality tools and to use it in my clinical work. So that's why I decided to take the ISQua Fellowship. It was a long time ago, 7 years.
Thank you, 7 years ago. Dr. Victoria, what was your motivation for joining the fellowship?
So I think for me, I didn't get into it 7 years ago, but rather 3 years ago. And coincidentally, I'd attended a conference, and one of the speakers was enlightening people about how to get more learning in terms of quality. I had already done a certification on CPHQ and I'd already passed the exam, but I still felt the need to gain a deep understanding in terms of global best practices, principles, and frameworks in quality improvement. I was already working as a quality advisor, but what I was really looking for was that deep understanding of the concepts so that when I am actually training a team or leading a team, I actually have the deep understanding and I'm not only training them on standards, but the concepts behind it. And yeah, in a nutshell, that's why I got into the ISQua Fellowship.
Wonderful, thank you. I'm going to take one other person's view on this. Dr. Pierce Kagoma, what made you choose the fellowship? Dr. Pierce, can you hear me?
I can hear you.
Okay, you were muted.
Yeah, I can hear you.
Okay, great.
First of all, at PRAJ in Tanzania, we started, together with the Ministry of Health, we started interacting with our fellows from Health Service Executive Ireland, where they introduced us on some learning platforms pertaining the quality improvement. So in order to build the capacity for readers in Tanzania, especially in quality improvement, that was #1 driver for our applications in quality improvement fellowship, ISQua Fellowship. But again, our leadership positions involves guiding the council, health management teams, the facility management teams, but again, the regional management teams in terms of clinical governance, but again, quality standards. All we needed was to just create our local expertise, but again, gain the global recognized training platform where we can improve our technical competence. But again, the involvement of ISQua, it provided the access for international expertise in terms of improving our practice. So that was what motivated us to, but again, myself on my side and my colleague, to apply for ISQua. Back
Wonderful.
to you. Thank you.
Thank you very much. Wonderful. And some very different insights from the three of you. Moving on, Ernest Jabi, how do you think the fellowship changed you? Did you see a sort of a before and an after when you'd finished the fellowship? Ernest, can you hear me? Ernest, can you hear me?
I wondered if he dropped off because I no longer see his name here for a moment. He was here a moment ago. Okay, there he goes. He's back.
He's back.
Yeah.
Ernest, can you hear me?
Yes. Yes, I can hear you. Sorry, I think I lost. Yes, I just lost network.
Yes, you dropped off, so let me repeat the question. We're just looking now at seeing, how did you think the fellowship changed you? Were you an Ernest before and a different Ernest afterwards?
Jackie, that was a great question. He looks frozen, so I
He's
suspect,
frozen.
yeah.
Let,
I'm sure he'll
let,
want to answer this question.
Stephen Balogun, can you hear me now?
Loud and clear.
Wonderful. Let me
Good,
pose that same
good
question to
afternoon.
you while we hopefully Ernest unfreezes. Do you think the fellowship changed you?
Absolutely. Yes, the fellowship did. And I'm always happy to share in ways where fellowship has really changed me. I always tell people right now I work in the public health space, but before the fellowship, I've always aspired to be a general surgeon. But then I did encounter the fellowship, and then the fellowship did encourage me to pursue quality and patient safety. And in doing that through the clinical medicine, I then the more I got involved in the fellowship program, the more I did realize the concept of going upstream and not really essentially focusing on people within the facility to the communities. And that's essentially what led me into the public health programs. My ambition to.
Great, thank you for that. You broke up a little bit towards the end, but I think we got the most of what you were saying. I'm not seeing Ernest back. Chica, if you can just let me know when you see him back. Let me put that same question to Dr. Ahmed Nawira. Did you find a change, or how do you think the fellowship changed you?
I believe that after I finished the fellowship and every year I gaining a lot of knowledge which make me competent, and I'm looking for challenges and quality areas for improvement in my hospital, and I'm always rushing to solve it. So I'm not reluctant like before. I believe the fellowship have this up to date and evidence based tools and practices which give me to my clinical background this quality concept. So I believe yes, I'm seeing the things with another eye. I'm looking for solving the problem, challenge myself, challenge my team, and really it's helped me to. I believe I'm working my best to increase this the quality and patient safety culture in my place. I'm taking what I'm learning in the fellowship and giving lecture and teaching my staff the new tools and encourage them, and even some of my many of my they are presented in the ISQua conference in some of their projects, which I'm really proud of. So yes, I believe I'm not the same like before. Yeah.
Wonderful. That sounds really good, and it seems not just you that it's changed, but
Yeah.
rubbed off on your colleagues as well.
Yes.
Wonderful. Dr. Victoria, did you notice a change in yourself, and how do you think the fellowship helped that change?
Definitely. I cannot compare where I am currently with where I was before in terms of having one deep understanding of quality improvement. And it's more than just it's not technical as we think of it, or as I thought about it before, of doing audits, meeting standards. Right now, my grasp is better. I have deeper knowledge in quality improvement and patient safety. The other thing, it has made me confident. It has expanded my identity as a leader or as a person who can guide in matters quality and patient safety. I find that now I'm able to participate more at doing tasks, the institution, leading some institutional tasks. And actually, as recent as I think in September, 2 months ago, I was involved in the planning of the World Patient Safety Day, even at the country level. So It definitely has changed my knowledge in matters quality and patient safety.
And raised your profile by all accounts as well.
Yes.
That's wonderful. So you're obviously seen as one of the national leaders now. Fantastic.
Yes, not really at the national level, but having to participate in organizing some of these events at the national level actually really does tell how much I have grown in the field.
Wonderful. Dr. Pierce, was there a similar experience for you, or how did you find that the fellowship changed you?
Thank you very much for a very nice question. I think ISQua is trying to preach to unconverted, and then I think after the fellowship, I was completely converted to be someone who is not the same again. So, like before the fellowship, my understanding on patient safety, clinical governance, but again on the issues to do with the health system strengthening was mainly rooted in domestic or the local practice and the national guidelines. But again, the collaboration networks, mostly domestic, with minimal interaction with international quality experts, but again, communities of practice. As PRAG, we are responsible for the supervision and provision of primary health care services in Tanzania, starting from the dispensary levels, health center levels to the district hospitals. Over 70 southern facilities, of which we are just making sure that we improve their qualities and patient safety. So after the fellowship, we have gained the deeper evidence-based appreciation on QI, quality improvement, but again, patient safety and clinical governance, which is aligning with the international recognized standards. But again, in Tanzania, we have started now to starting implementing some small quality improvement tools, which we learn in ISQua, like the PDSA cycle, where we are currently preparing a package for quality improvement in primary facilities in Tanzania. And then we are going to pilot. We are going to start it in 2 regions. And then from there, we just make, if we'll see the changes and the results, we are going to make a national scale up for other facilities in other regions and councils. So we have expanded our knowledge in quality improvement. Now we are very strategic and able to influence policies, implementing, but again, build capacity for our fellow healthcare workers, especially at the primary facilities, and drive sustainable quality improvement interventions. So thank you very much.
Thank you very much. Ernest, I'm so happy to see you're back.
Thank you very much. Sorry, apologies. I had to lose my internet, but
No, don't worry. I was asking you a question as you disappeared. So we're just wanting to know, how did the fellowship change you? Did you see a different Ernest before and after?
Yes. First of all, thank you very much. I think I had wanted to maybe briefly describe how ISQua, became part of my quality journey. Right. Way back, of course, one of the time I entered the Ministry of Health, one of the key strategic objectives of the health sector for us here is to transform the under-resourced. Because if you look at our health sector by then, it was under-resourced, it was ill-equipped. So the key strategy was for us to transform, this health sector into a more high-quality, focused ministry. So I became interested into quality, and then I find myself within the reproductive and child health space. And then, of course, in that space, the vulnerable groups of the population, there you will find them: pregnant women, children under 5, and then so on. So I was very much key in the development of the RC8 strategy. And then one of the key objectives of that strategy, when we reviewed reproductive and child health situation in Sierra Leone, we came to realize that one problem we are having is not just access, because we have been increasing access due to free healthcare initiative. But most times when they come to the facilities, they ended up dying, right? So quality of care, becomes a key objective. So I was very much key into moving that objective, but I needed some capacity, because quality, when I listen to quality expert, read through books, it's needed that kind of tailored training, and I was very much opportuned by then. Thank God, I think Dr. Elom is on the call. I was opportune to work with Elom. And then I came to, I looked at, I became interested into the tools, into the frameworks around quality, but the capacity wasn't there. And then here comes ISQua, right? Looking at how globally it is accredited, so even anywhere I stand, when I say I'm a fellow of ISQua, I think that one is good. So by then, I was looking at solving problems in isolation. But after the fellowship, I have that system thinking approach, how you can not just focus on where you are, but looking at the health system in a holistic approach, right? I think I became familiar with the tools. I became familiar. I became more practical, into applying the tools, because the improvement taught me that it is a science. You have to test something, and then based on the evidence you have, then you can then move forward. So I'm very much happy that it guided me to support the implementation of the National Quality of Care Strategy, which maybe I'll deliberate on as time goes on. But for now, over. Thank you.
Thank you very much. So I think all of you have expressed some quite profound changes. I want to dig a little deeper now and think about your actual career and the leadership, and whether you feel the fellowship influenced your career and your leadership. Stephen, can I come to you first on that one?
Yes, please. Go ahead. I hope you can hear me.
Yes, I can hear you now.
Yes. Please, could you take the question again?
Sorry, I wanted to know how you felt the fellowship influenced your career or your leadership.
Oh, great. Thanks. And I'm really happy to share this. I actually did mention I got involved in the fellowship program just shortly after my medical school. And then I was waiting to start my residency program. Like I did mention earlier, my residency was supposed to be in general surgery. But I really, the basic passion, given my experiences with quality and safety, has been to improve the overall quality of care within the country. Having experienced poor quality care of close family members in the past. So I had a colleague that got me introduced into the fellowship. It just really resonated with me in terms of all the things I wanted to do. And at that time, I felt the need to start a quality improvement team within the health facility where I was working. So essentially, I was the first quality improvement lead for the health facility. We had a couple of those improvement efforts that we did, recognizing how we can begin to use available data within to see what else can we make better, what else can we improve, and we started pushing that forward. What we did included improving postpartum hemorrhage and the prevalence of incidence of postpartum hemorrhage in the facility at that time. And over the years, the more I got involved in quality improvement, the more I wanted to really go upstream. And so the fellowship essentially influenced me pursuing my advanced degrees in public health. And while my advanced degrees in public health came up, I pivoted into the public health program. And over the years, I have risen all the way to being one of the leadership role within the US Center for Disease Control Office here in Nigeria. And so the fellowship has really been one of the key things that have pivoted all the things that I have done over the time and where I am currently being able to advance public health and being able to advance quality and safety globally, and especially within the country as well. I think I'll take a pause here and I'll hand over to someone else. Thank you.
Thank you very much, Stephen. Wow, it certainly has had a big influence on you.
Progress.
Who's there? Let me come to Dr. Ahmed, because you actually touched on some of this in your earlier response. But do you want to be a bit more specific about how you think that the fellowship influenced your leadership, particularly?
After I finished my fellowship, and my manager know that I got this interest in quality and patient safety, they started to give me and leading some initiative like reducing cesarean section in nulliparous and reducing medication errors, starting to give me some project lead, and really I was happy to lead this team, and we really achieved a lot of our target in this project. And also they started to give me and to lead the accreditation team in the hospital, which really I found it's very helpful to have to organize the team, and we achieved as a national accreditation and also JCI accreditation. So I believe yes, it's started to, because the hospital they know already that you have this knowledge, so they start depending you in this point, and they started to give you this task, and because you can do it, you have the knowledge, you have the experience in it now.
Wonderful, wonderful. And you've again commented on this about your colleagues. You obviously watched them grow as well, which must have been really wonderful. Dr. Victoria, you also touched a little bit on your career earlier, but do you want to just talk about how you feel the fellowship specifically influenced that career?
Thank you for your question. So yes, as I had earlier mentioned, first, it helped me build my confidence. Two, you have the knowledge. So when I am working with the teams or the section or the departments I support in my institution, I had more in-depth knowledge to guide them even on how to do a continuous quality improvement project, how to do a failure mode and effect analysis. Then I found that with time, in terms of my knowledge and expertise, I was then selected to be able to be a physician surveyor for JCI standards within the Aga Khan Development Network hospitals in the region. So I must say the ISQua Fellowship really has led to a positive trajectory in terms of my career. I recently also led within the institution, holding the first World Patient Safety Day Symposium within the institution and later within the country. So I can say I am progressively becoming more and more of a thought leader when it comes to quality and patient safety, and that is all thanks to the knowledge I have gained for the last 3 years through the ISQua Fellowship.
Wonderful, a thought leader. It's a really interesting term, and I think an important one. I hope some of those watching will pick up on that. Let me move on, Dr. Pierce. How do you think the fellowship helped you and prepared you to lead quality and safety initiatives? Because you've obviously done quite a lot of them. And do you feel that it pushed you more into that leadership role? You're muted, Doctor.
Hello, can you hear me?
Yes, we can hear you now. Thank you.
The fellowship has first enhanced my strategic thinking, especially shaping my ability to analyze the primary healthcare challenges in terms of quality improvement, where we are using some simple tools and going back to the dispensaries in Tanzania, health centers, district hospitals, to mentor and inspire the teams, as quality has been one of the national agenda currently, and we are trying to embed them in the routine clinical practice, but again in routine meetings in the council health management teams and the regional health management teams. So it has also expanded the confidence in leading reforms. So like currently, we are just training some leaders in quality improvement in Tanzania, where we can just build the confidence to improve quality in their working place using the simple tools and the skills which we obtained in some of the modules in quality improvement, but again, modules in leadership in healthcare and some modules in patient safety. So that is how it has improved my career. Thank you.
Wonderful. Thank you very much for that. And again, what I'm hearing from you is I was hearing from some of the others about how it's helped you to influence other people as well, which is great. Ernest, can I come back to you now and to talk about, obviously during the fellowship, you get to talk to people or see people from all over the world. How do you think those global connections expand your understanding of quality and safety?
Yes, thank you very much. I think for me, in the first place, just as I started, this is it. Joining the ISQua Fellowship was a great opportunity for me. It was one, as colleagues have already mentioned. The confidence in mastering the methodology for QI is really top notch. I can confidently stand anywhere, practically use the model for improvement. I think that one I can easily tell. And then my global partnership, has also helped me to be able to listen to colleagues, colleagues that have carried out improvement efforts. I place myself in a position wherein I can be able to benchmark, some of the best practices that have been done in other settings. Quite recently, for instance, I was in Japan. I went to look at how they are doing QI using the Kaizen approach. But with my background of the ISQua Fellowship, I was able to see how to fit in the model for improvement for me, which we have universally used here in Sierra Leone. The model for improvement has helped me to be able to lead quality and to also support the leadership of district participants and even national participants. I was able to put them in a position wherein they can easily not just when you have a problem, when you have an opportunity for improvement, for instance, you don't just go and then you think of solutions. That has been the traditional issue. But for now, with the QI lens, they can be able to use problem analysis tools, simple tools like fishbone diagrams, simple tools like I remembered when I was conducting a leadership training, because that was where we started as a country. We wanted to bring in the leaders, because if the leader is not committed, is not committed in providing quality, then nobody else will provide quality. So what we did, we have district medical officers, directors, and then we bring them together, take them through some leadership for QI. And one of the tools I can still remember, one of the tools I thoroughly took them through was the Pareto chart, and they welcomingly love it. Now you go to their offices, they can easily look at the problem and then analyze and then come up with small changes that they can test to see improvement. So with all of this, it's been made possible because of my global network, my global connections, talking to colleagues, whatever I have, if I have any difficulty, I have to share it to certain platforms, for for more insight. So I think for now, this is what I can say. Thank you.
Wonderful, thank you. And sharing with colleagues in other continents. I mean, that sounds that you really have made great use of the network. Wonderful. Dr. Stephen, if I come back to you, might be a bit of a tricky question, this, but was there a challenge or unexpected lesson that shaped you during your fellowship? Dr. Stephen, can you hear me?
And if you're speaking, you're mute.
Okay, we'll send him, maybe you can send him a message in the chat. I'll move on to Dr. Ahmed. Did you have a particular challenge or unexpected lesson that you think has shaped you?
I believe, studying the fellowship, and at the same time, I was trying to implement what I'm learning. So sometimes you get a lot of ideas, and you don't know which idea to start, and sometimes you are hit with the resources that you cannot improve everything you are facing. So I started, even maybe this could discourage you a little bit, but you have to. I learned also in the fellowship how to prioritizing every if you have a lot of things to do, you have to prioritize it according to capabilities, according to your resources, because we, mostly in Africa, we have our resources maybe have problem in some areas, so you have to put this in mind. But I mean, studying the fellowship itself, really, it was fun, really, and sometimes I'm using the tool, I'm doing the assignment, I as exactly what I have done in the hospital. So really, it was fun. So I mean, the challenges is the knowledge and the ideas I got, and I want to improve everything. This is the challenge. I have to slow down a bit, and I don't lose this passion to improve. And with the help of our leaders and also with my friends and my team, we will fix everything in time. This is the challenge I have met.
I really like that one. I think that's great. Fix everything in time. Well done.
Yeah.
Dr. Victoria, did you experience an unexpected lesson or a challenge on the way to the fellowship, during the fellowship?
Yes, I must admit, first of all, adult learning is not easy. Creating time for family, you still have a full-time job, and you have to complete the assignment was a bit tasking. But nonetheless, for you to learn, you must first be willing to seek the knowledge. And I also had to unlearn a lot, I must say. Going through case studies, reading a whole paper, for me, it was a new concept, but I had to learn to really follow through. And actually, the case studies have really helped me to have deep reflection on matters of patient safety. You read a case. I remember there was one case where this scenario had been given of a baby who had, I think, Hirschsprung's disease. And the mother kept on pointing out that something is just not right, and the nurses didn't get it. And later on, sadly, the child succumbed. So for me, such things have helped me put additional insight into my work. And even when I am mentoring the teams I work with or teaching the teams I work with, I actually have case studies that I can also share with them for their own knowledge, not directly, but to be able to build case studies to highlight certain concepts that we are teaching. So I say navigating and balancing initially was tough, but now I've gotten a hold of it. Yeah.
Wonderful, wonderful. And let me go to Dr. Pierce. Did you have any unexpected lessons that helped shape you during the fellowship?
Thank you, Jack. I think the challenge I encountered, one, adult training is not easy. So sometimes balancing intensive fellowship demands with the high pressure leadership roles, trying to balance some of the leadership role at Pure Raj, managing the fellowship workload, some of the modules. This taught me discipline, but again, it taught me time management and prioritization when it comes to the undertakings of the fellowship. But the skills now that I have with the fellowship helped me to read those complex frameworks without compromising, again, quality. But again, another challenge was some of the tools and some of the modules were developed in well-resourced settings. So when the challenge was learning how to adapt these tools, these global best practices into our raw resource countries, especially Tanzania, and adapting them in rural facilities like the dispensaries. That was again another challenge. So in totality, after the fellowship, it all strengthened our system thinking, how we can contextualize the skills from global perspectives and innovation mindset in order to improve quality, especially to the low facilities in our country. So that was most of the challenges I encountered in the fellowship. Thank you.
Thank you very much. I'm sure what you've just said about working in a less resourced environment, I'm sure that's resonating with some of the audience, and perhaps they'll have questions about that coming up. Stephen, you're back. Wonderful. Well, I was worried we'd lost you. I want to move on to what we can tell future fellows, and just maybe you can think about what growth or opportunity do you think future fellows could expect? You're muted, Stephen.
Yes, thanks. I'll start first with some of those challenges that we've talked about. I wanted to contribute. Number one would be in terms of generally quality and safety are more tailored towards clinical medicine. So expanding or extrapolating that into public health was relatively challenging. Just like Hennes talked about, adapting to low and medium income country. The other was adapting into the public health space, given that a lot of this came from clinical medicine. And that was also one of the challenges. The other is managing people from this part of the world. You know that consultants generally think they make those decisions, and you being able to work with them to let them realize there is also room for quality and safety, and also get their buy-in along the line was also relatively challenging as well. But in terms of communication to future leaders, future participants, I'd really say that quality and safety is really worth it. I think, and as much as we can, it's not more or less parallel to our primary roles, primary responsibilities, or primary interest. It's applicable to all fields, whether it's pediatrics, whether it's clinical medicine, whether it's public health or anything like that. So you really find value, and you will find a lot of meaning in doing quality and safety, or adding quality and safety to the things you're learning. The other thing will be start early. For many of us on this call, I think a few things we'll probably say is that we got introduced into this to a large extent after we finished our primary degrees. But I do know that across the globe, there are efforts to bring it down now, to making it as early as possible in people's learning journey. I think really starting early also is one of those things that I really tell people to do. To use data as well, quality and safety, you cannot separate it from data to a large extent, and you have to use data. And overall, just to recognize and tell people that One of the biggest quotes I like in quality is telling you that you have what you need. So just make sure you use what you have to become that thing that you need to get the results that you desire. So what you have is enough. You should be able to start with it, no matter how small, start small. What you have can become what you need to get those results starting to come. Thank you.
Those are some wonderful lessons, and I can certainly vouch for your use of data. He is quite extraordinary when it comes to data usage. And I'm going to hand over to Chika. People might be getting tired of my voice, so Chika to ask some more questions of the panel.
No, Jackie, we're not getting tired of your voice. You've done an amazing job. It's been a great conversation, and thank you so much for leading us through this far. And it's two things I've been doing since the conversation is smiling and nodding, because I truly believe that healthcare quality and safety is a global language. I've done quality in many places, and we're all saying the same thing with a local accent. And I'm hearing the global language come across everyone, and then some local distinctions. So we'll continue on the questions on advice and future, because this part is now for our audience. What can they expect? I'm going to come in with a fully loaded question, which is, what role can African fellows play in shaping the next decade of patient safety and quality improvement in our continent as well as globally? And I would love to hear from all our panelists about their thoughts on this. I'll start with you, Dr. Victoria.
Yes, so the role of the ISQua Fellows, one is, remember, slowly by slowly, the numbers increase. We are all living through the same and working in the same African health systems, largely faced through the same challenges. If we work together, bring voices as we are from each and every country in this continent, each and every district or each and every unit in this continent, then together we're able to advocate for solutions that actually favor the African health systems, because as one of the panelists said, you have to start small. We can no longer keep on waiting for people to come and rescue us. We have to start implementing solutions from where we are, and slowly by slowly actually grow. Thank you.
Thank you so much for that. Dr. Ahmed, I would like to hear from you.
I really, when I was first time to meet my African colleagues, and really we in the last conference in Sao Paulo, we had a meeting, and us meeting there. I believe we have a lot to do, you know, and the level of the continent first, because we are a lot like we need to gather all, you know, we know the actual number of ISQua fellows in every country, because we are a lot. And then I believe we need to do regular meetings to share our issues and our problem we meeting, because, you know, we have to learn from each other, from peer to peer. And I believe, I don't know, maybe we need to do some kind of hub or something to have a continuous sharing ideas, sharing problems. We might find someone have an issue, have the same, so we can think together. I believe this is nice. You know, we need to have some kind of something connecting us in a regular way. I know we have online meetings every while. I understand this, but I think we need something more together, these ideas and challenges for our meeting and how to fix it. Thank you.
Thank you for that, Dr. Victoria and Dr. Ahmed. You've just planted a bit of seed in my head, because you're right. We have a lot of African fellows, and where do we connect? Because what you learned first is we have so much work to do, right? And you know that just because you've gone to this fellowship, you cannot do this work alone. So how do we come together, learn from each other to actually build more capacity within our space and have this work move forward? A brilliant idea, one that you just planted a seed, the one that we will discuss more within the committee. I would love to hear from you, Dr. Pius. Pius, thank you for allowing me to say Pius.
Yeah, thank you very much. That's a very nice question. As African pharaohs, we have a critical role, especially in building culture for patient safety and accountability in the continent, because we are all in the same African continent. So in Tanzania, we are trying to build a quality culture where next year, 2016, we are planning to conduct the second International Primary Healthcare Conference, where we want to gather some quality improvement experts in the continent to come together in Tanzania and discuss the ways and the innovation on how we can improve quality in our healthcare services in our countries. So because we understand that every country is uniquely positioned in terms of their global and contextual best practices to fit their local need or their local realities. So bridging that gap, we should come together. And I think we as ISQua Fellows, we need to champion the capacity building in our countries, have regular meetings together like this in our continent to see how we can translate our knowledge into reality. But again, the issues of South-South collaboration to ensure quality of patient and patient safety is integrated into routine care. So that's all when it comes to our role. We have a very critical role on that. Thank you very much.
Thank you. I couldn't agree with you anymore. And please leverage the forum of AfCoP as you move forward in your journey, and is one of the reasons why we're building the AfCoP community as well. Make sure you're tapping into these resources. Reach out. Let's also find out better ways to collaborate. But really brilliant ideas, and I couldn't agree with you more that African fellows we are centrally should be central in helping build the capacity for quality improvement in our continent. Doctor, have we lost? Okay, Stephen, you're here. I think we lost Dr. Ernest. He's back. But Stephen, let me also hear from you on this question. Then we go to Dr. Ernest. Dr. Stephen, are you there?
Yes, I am here. But apologies, I lost you briefly, so I didn't get the question. If you
Sure.
could help me take the question.
Absolutely. The question is, how can African fellows play? I mean, what role can African fellows play in shaping the next decade of patient safety and quality improvement in our continent and globally? You look frozen. And if you are,
Great,
that's
great,
okay.
thanks.
Okay.
And I do know that we have people who have started. Please confirm you can hear me.
I can.
I do know we have people who have started, and I think we can really scale that up. One of the few things we can do is get other people engaged. I think one of the very first things that I found very useful when I started my fellowship is it's relatively easy to just possible when you open out of free resources, you can share those resources to people. When they read and learn from there is those communities of practice like one of those communities of practice that we already know is the ISQua African Community of Practice. We know the AfCoP. We do meet monthly, and this is one of those sessions. Getting engaged in this session is really great. We have the other ones, SQUAN, specifically from Nigeria. We have Acquire, which I believe is from Kenya, and a few other things as well. Getting to be part of this community of practice is really important. I think the other things are also related to reaching out to each other. I think we have had conversations around having maybe a community WhatsApp group in the past. I think people in their small groups have WhatsApp group. where they provide support to each other. Sharing resources is also really very important. I think people really, I'm part of a couple of, I like Jackie mentioned earlier, I also use data, and I know that one of the things that has really been supportive in the data community is essentially that community. You can always get help relatively easily. A lot of groups where people can always reach out to you, where you can also reach out to people. So doing something similar for the quality and safety community is also really very important. Also being deliberate in terms of conferences and attendance. We do know that last week, I believe, the call for abstract for ISQua Conference 2026 came out. Really would want to encourage people. I'll be honest, one of the key things in the last few 6-7 years that have really been pivotal to me, for me, was attending the ISQua Conference 2019. I got to present abstract and I got to present oral sessions. We had a quality improvement competition for the first time, and it really did expose me to a lot of other things that people are doing globally across the country. I'm happy to let you know, of course, I was the first runner-up, or what I presented was the first runner-up. The winner was from Japan, more or less. So it did really get me connected as well to a lot of people. So I do encourage people, please be part of those discussions, conversations. The quality improvement community are always happy to provide support. I did get to meet ISQua CEO, ISQua president, and a whole lot of other people who have relatively been instrumental. So those are some of the things I'll just really say. Thank you.
Oh, thank you so much. Thank you for being deliberate about, bringing forth some of the organizations or movement happening already in our continent. We need to also learn to network more and collaborate more. So I appreciate that. And Dr. Stephen is always a silent voice of data. And the truth is, in quality and safety, we all know that we can't go anywhere without data. So he is spot on in terms of, can we all leverage different aspects, our expertise, bring it to a pot to elevate the practice of quality and safety in Africa. Dr. Ernest, I think we've lost you again. We would have really loved to hear your perspective on this question, but he's not here right now. I will come back to him as soon as he joins back in. But before we move forward, I do want to bring an exciting offer that I heard. I just got the news while we were on here. ISQua is actually offering a 20% discount to the panelists and to the audience for today that attended today for fellowship and membership. So if you are here today and want to know more, we just got a 20% discount live, and the code is AfCoP 2025. There you go. Katerina just typed that in. So that is wonderful. So I wanted to make sure I make that announcement because I know people drop in and people drop off because of internet issues and whatnot. I think that's wonderful. So we thank ISQua for this continuous support of us trying to get more knowledge in this sector. So awesome, awesome, awesome. Dr. Ernest, are you back? Because we really love your perspective on this. Okay. Maybe when he comes back. Oh, here he is. Dr. Ernest, can you hear me?
Yes, I can hear you. I can hear you.
We were waiting on you to come back
Okay.
and answer this question.
Yes,
So
yes, yes. I really wanted to give my insight on this. I don't know if it's
want to hear it. Yes,
No.
please. Did you hear the question, or do you want me to read it again?
Yes, you can read it again.
Okay.
The role of African
Yes.
ISQua Fellows.
Yes.
Yes. Yeah. So I think moving forward, just as colleagues mentioned, I think we have a few of us that are presently doing that are fellows that I know of, right? So I think part of the way to spread is, I think, one of these mechanisms that we are carrying now, which is daily webinars like these ones, right? And then even supporting learning networks, because that is the one thing that I gained from this fellowship, right? I was able to kind of institute a learning platform within the Ministry of Health, Sierra Leone was the first country, to within the global network to have a learning collaborative, wherein we're able to bring facilities, we're able to bring researchers together just to come and share experiences and then to learn, because that is very much important. So I think moving forward, we need to have that hope, right? Because the ISQua Fellowship is not just the endpoint. It helps to shape your career, whoever you are, whether you are a pharmacist. As for me, I'm a pharmacist, and then with the quality improvement lens that I have now, I think it makes you to be more proficient, in your career. It makes you to be more strategic in your decision making, right? So I think it is very much key. And then also, we can be able to translate standards, global standards that we have into our local context, right? And that for us, we have done as a country when we started. We started with the maternal, newborn, and child health standards. They were global standards. We, were able to adapt them, in our own context. And today, that is where we started. Have those standards, contextualize them, do an assessment, kind of a gap assessment to see where we are with those standards. And then we drive improvement efforts, starting with capacity building, a lot of capacity building, across health facilities. And then we train them, provided on-site support just for them to be able to do continuous quality improvement to meet those standards. So I think it is very much key. As fellows, let us support standardization of these standards. Capacity building as well, and then building, learning platforms, learning networks. Quite recently, this is something that I wanted to share. Quite recently, I was supporting a facility, and then this is also one thing that we have done that the fellowship has helped me to do. Right, I can able to drive now QI, not just for maternal and child health, but across the board, because everybody needs quality. Every intervention actually needs the approach, So we have a facility at one of our districts who presented his mini quality improvement project on the improving immunization services. When the team lead for that quality improvement team presented his project, starting from the standard, starting from how he identified the problem, going down to problem analysis, going down to coming up with measures for data collection, coming up with changes. When he showed the results, he received a standing ovation. So that tells us that continuous capacity building is actually needed. So for me, I think as African fellows, it is not just the endpoint, but the fellowship can also help to shape your career, whether you are a medical doctor, whether you are a midwife, or whether you are a pharmacist, as I am. It helps you to think strategically and to solve problems, based on, to approach problems based on data. Colleagues have mentioned the importance of data, and that one I do, because so that is also our Bible, because without data, then you cannot tell us anything. So and it forms part of the key cautions in the MFI. So I think these are my take for the involvement of fellows into the African region. Thank you.
Thank you so much, Dr. Ernest, and well said, well said. I want to again thank you for highlighting the fact that quality belongs to every sector in healthcare. You mentioned pharmacy, you mentioned nursing, you mentioned lab, all aspects, because it's all about improving the systems built. So thank you for lifting that voice up and also again echoing the need for capacity building within our space. And also identifying every one of the panelists, you've all identified the key role our fellows can play. I'm looking at the chat and I see that a lot of us are very excited about our newly discovered discount. So thank you again, ISQua. This part now is for the audience where we'll want to hear from you, hear your questions, comments even. Let's start to share. But before we go there, I want us to also strengthen our networking abilities because this is really how we continue to connect. Make sure that we're all following each other. If you're on LinkedIn, find ourselves, network, listen, follow each other. Let's find
Yeah.
follow AfCoP from Kenya, follow any quality improvement organization, follow SQUAN, follow Society. Let's start to just follow each other and see what we're doing and learn from each other. That is one way. And I know Stephen mentioned, WhatsApp, many channels in which we start to connect. I am meeting some of you for the first time. And I am so interested, intrigued by all that you've said. I'm going to find you and I'm going to stalk all of you and continue to learn from you. So, this is how we continue to build that capacity within each other. So, please, let's all do that. Um, so let's turn to Q&A. We'll use this last session to do that. And before we go into that, thank you again to the panelists for bringing your knowledge, insight, shared experience with sharing that with everyone. All right, the first one says, this is from Emily. Structured QNS learning, especially through fellowship, is a game changer as a holistic approach, personal, team, and system-wise. The scope of fellowship learning in healthcare is so wide, from frontline workers to decision makers at all levels. We need to advocate as fellows to reach out to our ministries of health to formally adopt QNS, in which quality improvement is in particular becomes one of the strategic pillars. If this wasn't a question, but I wonder, does anyone have a comment on that? I couldn't agree more with you, Emily. I agree. Any comments on that? Or is it just one of those like we are like, yes, we completely agree.
Well, maybe for me, I think it's just to one of the good things about QI. It places you to to provide an answer in a structured way, so the approach, the methodology with the fellowship, you can be able to master the methodology, and whatever intervention that you want to carry out, you can be able to do it in a very structured way. And then with the system thinking mentality, it also helps you to look at the system right across the board, right across the inputs, right across processes, and then right across the outcome. So it's a whole lot. If I can just add my voice. Thank you.
Thank you, Dr. Ernest. All right. There's another question here. And please, if you want to speak up, this is for the audience, raise your hand and we'll pull you in so we could hear from you directly as well. The next question says, I have a basic question. Do you as a country have any guideline on hand washing in labor room, emergency room, or do you all follow the WHO 6-step of hand washing in these critical areas, except in OT where hand scrub has to be strictly followed? It would be nice to know that internationally we all follow the same guideline because there are assessors who tell us WHO 6 steps are guidelines for general hand washing. This is a very unique question for hand washing. And if anyone, regarding the WHO 6 steps, does anyone have insights on this that they can answer? This was a very specific question regarding hand hygiene. Anyone?
I can speak, and as we all using WHO, I think is the reference for all. We don't have our own national guideline, but we are putting it, even we are printing out the WHO papers and putting it in our every department. So this is our reference, yeah. And I don't know other country, but this is in our side. We are following the WHO's.
Thank you, Dr. Ahmed, for that. And I think also to add to what you've said is every organization could get to decide if they want to use a different guideline. I think the end point is clean your hands before so that we don't transfer infection. Whichever guideline you use, let it arrive at the same aim. But thank you for this question. Let me check here. I don't know. Have you seen anything through the chats for question? You're mute. Oh, wait, there's another one.
Sorry, I'm talking to myself. I think everyone got overwhelmed by the discount. They were asking questions, but one's just popped up now from Aaron saying, how can we identify common research issues on quality and safety in Africa? And what role can AfCoP play to promote research and share knowledge on research findings on quality and safety in Africa? Great question, Aaron. Would
Very
one of the
great.
fellows like to try and answer that?
And Elam as well.
Yeah, Elam, you're here. You're good on research.
Yeah, I mean, I ironically, I am in a research meeting now. That is why I couldn't join from the beginning, and we are discussing research, but specifically with respect to non-communicable diseases. I think that for us in quality, we should also see quality and the process of quality as evidence generating, and then how that evidence can help us improve the outcomes that we seek to improve. I mean, the process of the quality improvement process, which is also very similar, I mean, to implementation science and implementation research. So if you have that knowledge of research, it enables you to, whatever evidence you generate and you say that this improvement works, you are able to say that confidently, because the process had been very rigorous in helping you to arrive and to make that conclusion. So that is what I would like to say. We don't necessarily have to be researchers, but in doing quality improvement, we should be mindful of the research process in what we do. We might not need sample size to estimate sample size. We might not need to estimate p-values and statistical significance and all of those highfalutin things. But we should just be conscious that if we want to replicate our findings, and which is what our journals require, the ISQua journals and any other journal, if you want to publish, we are interested in the process, and the process for arriving at whatever evidence you claim works will have to be as rigorous and should be able to stand the test of time and should be reproducible in Sierra Leone or in Egypt or in Kenya. So that is what I will say with respect to research. Thank you.
Thank you, Elam. Timely. Everything is timely, and we really do appreciate your insights on this because this is your field. Anybody else? Any of the panelists want to add to that question?
Yeah, thank you. I believe, like Elam said, our rule always are encouraging if we are finishing a cycle of improvement, or we are encouraging our staff to and helping them to publish it, and like Elam mentioned, that it's different than in quality improvement to project. It's quite easier than a research, when you are, and in ISQua we have two journals we can help, Elam and also me, I'm working in one of the journals. We can help guide you how to write, and if you are still in the beginning, you don't know how to write, we can guide you, and we can send us, we will help you to guide you how to write quality improvement to project. And even we can do one of our online session for how to write quality improvement to project. I believe we can do it in the future to help people to write their project and publish it. No, thank you.
Thank you, Dr. Ahmed. All right.
There's a very good question from Flavia saying, does quality of healthcare include client rights, safety, privacy, and needs? Sorry, I came late. Don't worry about coming late, Flavia. But I want to give a resounding yes, 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 yes. If it doesn't, it really should. Because if we are considering quality of healthcare and we're not considering patients and their rights, we're not doing quality. And we're missing huge opportunities because patients have an amazing say in their care. I don't know if Victoria or any of the others would like to comment on this one as well.
Thank you.
Yes, I do agree. And actually, one of the domains of that define quality in healthcare is actually person-centeredness. And person-centeredness actually is based on respecting or acknowledging the patient rights, responsibilities, privacy and confidentiality, respecting their culture, their beliefs, and also their preferences. So yes, it is definitely a big part. Actually, it's at the center of defining quality in healthcare. Thank you.
Maybe I add something on that. Yes, quality in healthcare absolutely is includes client rights, safety, and privacy needs, because these are the key components of globally accepted quality standards, including the WHO, but again the ISQua, and some of our national quality frameworks. So they are all including client care, where we can quality care respects the how we can protect the patient rights, including the right to information, right to informed consent during provision of care, the right to respective and dignity care, the right to be involved in the decision making about their health. But again, the issues to do with the patient safety. Safety is one of the key dimension of quality, preventing avoidable harms, reducing medical errors, reducing surgical errors, and some of the safety environment. So that's all, and I quite agree. Yes, yes, yes.
Thank you. Thank you so much for that. Yes. Flavia, I think you do have a follow-up question that talks about ethics, right? And I think they're all in the same place. Do you consider ethics using the Patient Rights Charter as part of areas of measuring quality services? Dr. Victoria mentioned the patient-centeredness, so I think is a resounding yes, yes, yes. But anyone else who would want to add to that, please, you're welcome.
Yes.
Please go ahead, Dr. Ernest.
Okay. Yeah. So I just wanted to, because there is a caution on ethics, and I think that is one of the program I'm now supporting, and then so thankfully the ISQua Fellowship, is placing me in a very strategic position. So one of the gaps that we have as a country is in the area of regulating the human resource that are providing the services, right? Then because we have been preaching patient-centeredness as one of my colleagues mentioned, right? And for Sierra Leone, when we defined quality, patient-centeredness is kind of forms the core of the definition, right? So to see that healthcare workers are not conforming to their ethics, I think is a violation of the patient right. So currently, as I am speaking, we are trying to see how we'll bring together regulatory bodies, how we bring together training institutions, and then healthcare leaders, right, to come and actually discuss what is the problem around ethics, what is the problem around practice, So I think it is very much critical to consider. Thank you.
Thank you so much, Dr. Ernest. Dr. Stephen, you're not on mute. Thank you. Thank you for that addition. The next question is from Zacharias from ACSIS Ethiopia. The question is, what is your take on integrating the science and concept of system complexity into the usual quality improvement training? I don't know if we can exclude it, but let's go ahead and hear from our panelists.
I think my take on integrating systems complexity into usual quality improvement trainings Yes, like in Tanzania, we do some of the quality improvement trainings, but integrating system complexity into QI training is essential as it helps readers, especially the readers in QI, quality improvement teams, to understand the system complexity and dynamics. But again, how they can connect and influence multiple factors. So when the staff or the healthcare providers appreciate that complexity, they stop looking for simple linearity solutions. Instead, they adapt the system-driven approaches. So this leads to more realistic interventions in better solving some local problems for local solutions. Stronger teamwork, but again, for sustainable quality improvement, we need to train them. Thank you.
Well said, Dr. Pies. Anybody else want to add to that?
Yes, so let me just add. Particularly, anytime I hear about systems thinking, I always remember that central law of improvement, that every system is perfectly designed to get the result that it gets. So that is something that I so passionate about. The results that you get is as a result of how your system is. So looking at that, the harsh reality is we want to provide, because that is the problem that we have with our health facilities. Building that capacity, they want to provide quality services. Even when we started, they want to provide the services. Sometimes when we go to visit on-site support, they will say, Ernest, you say how can we provide quality when we don't even have water? How can we provide quality when we don't even have the basic consumables or the basic equipment? So that is the harsh reality. What is on ground compared to what we have on paper is a little bit different. But one of the message that we normally tell facilities is there are simple processes, right, that can be improved, that do not even require resources, right? And then so that is where they will start from low-hanging fruit, and then with a system thinking mentality, right? Looking at resources, looking at the input, what you need. There are things that are within your control, things that are also outside your control, and then you look at what you do with what you have. And then you also measure the outcomes. So that is sometimes the problem. You start small, and then you progressively learn. You learn, and then you can be able to move forward. But I think teamwork, is very much important in ensuring that the system thinking drive moves forward, because everybody in the team has a role to play, right? And that is even the message that we even give to facilities, that in the process of you forming a team, anybody that is involved in the process, has to be part of solving also the problem. Even cleaners, can be co-opted into quality improvement teams. So it has to do with teamwork. It has to do with having a system lens, holistic approach instead of working in silos. Thank you. Yeah.
Thank you so much for that insight, and for all of you for your insights. One of the things that I've used in terms of with complexity in quality is dosing. I don't know if there's a book, I can't remember the author right now, it's from IHI, who wrote a book about dosing quality. And that's when it dawned on me the art of understanding the complexity. But just like Dr. Ernest mentioned, the cleaners, they have a part to play. So you dose their part to them, but also giving them the wholesome picture of how this part contributes to the entire infection prevention in the organization. And then nurses, you dose this to them, and physician. And I think in doing that, it does help with sort of dissecting everyone's part, but everyone sort of would have that mindset of a global goal. So I really appreciate you bringing that insight forth. We are at time. We have 4 minutes left. And this has been so insightful, so rich, so valuable. There was a question for you specifically, Jackie. I think it's been answered, so I moved forth. Is that right?
That's fine. That's fine.
Okay. All right.
Well, oh no, actually, I think Dr. Ahmed's answered something slightly different. He's talked about systems thinking. But my answer, Professor Emile, would be I don't think there's one specific roadmap to help countries build a sustainable quality environment. But I think a good place to start is have standards, have things that people can measure against so that they really understand what they're doing, and inspire. Get people, get the people like the fellows out there inspiring people to work and involve everybody, make it a team effort. Thank you.
Thank you, Jackie. As we come to the end of the session today, I want to extend our sincere thank you, gratitude from the AfCoP community of practice to our panelists for giving your time to this, and not just bringing your time, but your insights, your knowledge, your experiences, and sharing it openly and honestly with everyone. I think your insights helped us see purpose and impact of ISQua Fellowship, not just in our continent, but globally. But for us, it's also helpful, it's encouraging for us to continue this work. You know, sometimes when you're in your own space, you forget how important this is to this work. So just hearing from everyone, hearing about the impact you've made is encouraging and it keeps us going. So we thank you for that. And for the audience who stayed, who came to hear about this, I hope this has brought meaningful value to you, some purpose, or clarify if this is a good path for you to follow. But at the very least, the community that we're building and networking that we can strengthen. I hope this has created that forum for all of us. So on behalf of the African Community of Practice, thank you once again. And on behalf of ISQua, I wish you a wonderful rest of your day. And thank you, ISQua, again for the discounts that we've all received.
Yeah,
Thank you,
I think
everyone.
you wish them Merry Christmas in advance because this is our last
That's
webinar.
right. That's right. That's right. This is our last webinar for
Thank
the
you.
year. Thank you. And we will see you
Thank
guys
you.
next year. Happy New Year, everyone. We'll see you in 2026 in health and in wealth.
Thank you.
Thank you all.
Thank you.
Thank you all.
Bye bye.
Thank you very much for the
Thank
opportunity.
you.
Thank you.
Bye-bye.
Thank you.
Thanks,
Hey,
Ella, for
Ahmed,
reminding us.
Ernest, all the best. Good to see you.
My
Thank
pleasure.
you.
My pleasure,
Thank you,
Elo.
Elom.
Yeah, bye.
Bye bye.
Yeah.